This is Jeff Scott again, and we're going to continue our discussion talking about climate change and how it affects public health. One of the most significant things about climate change is that it affects coastal areas differently than it affects areas that are more inland. Now, the reason this is so important is because over 50% of the world's population lives in the coastal zone. So if we take a look and think about this for a minute, this really means that that's the world population statistic. If we move a little closer to home in the U.S., that number is about 55%. So if you think about 55% of the population living in an area that's only 11% of the land area, that has tremendous effects in terms of how climate change can affect public health. One of the significant findings that we see on public health and climate change is the effects, if we look at things like harmful algal blooms, the occurrence of infectious disease, the occurrence of mass coral bleaching events and things such as this. One of the things we know is as more people, as we pay paradise and put up a parking lot with urbanization, we have over 5 times more people per square mile in coastal areas compared to inland areas. We also have 5 times more attendant economic development and the attending pollution that goes with that activity in the coastal zone. So when we begin to take a look at coastal areas, it's not surprising that we see these occurrences of harmful algal blooms and the occurrence of many of these events, because it's the attending pollution that goes with urbanization that really causes this effect. And if we take a look, for example, how are coastal areas doing? If we look at our report card for coastal health in those coastal areas, we can see that the coastal areas are tremendously affected as we take a look at the National Coastal Condition Report. 40% of our shellfish harvest areas are harvest restricted for safe consumption of shellfish. We can see that over 13,000 beach advisories in a single year. That number has now gone up to over 35,000. And if we take a look at other metrics, 2/3 of our estuaries are basically eutrophic. So if we take a look at the numbers as they come back to us about how ecosystem health is doing, it's not doing well. And we know man being a part of the ecosystem, if the ecosystem is affected, so is man. And so this really gives us a pause to think about how differently coastal areas are affected. One of the attendant problems is the compression of all this population into a small area. What we have really done is we have transformed the hydrological cycle and the landscape ecology because we paid paradise and put up a parking lot. If we take a look at this slide, for example, it illustrates here in South Carolina the population growth in coastal counties. Nowhere else will you see population doubling times of 20 years as we see in Horry County near Myrtle Beach. The only other part of the world that has that type of population growth is sub-Saharan Africa. And there we're not trying to maintain the environmental conditions, and we're not trying to maintain a high standard of living, because we usually with that type of rate of development you can't. So that is the real challenge that we have in coastal areas, and now we put on top of that climate change. So urbanization has really made our understanding of climate change in coastal areas an additive stressor to climate change. And this next slide sort of really captures this in a conceptual model, and it really shows the drivers of population growth. As we see increased population growth, we see the attendant change in land use, the attendant increase in runoff of nutrients, chemical contaminants, microbes, which in turn leads to loss of ecosystem services. The very thing that people like along the coast, being able to recreate in the waters and eat the shellfish, those are ecosystem indicators that are affected. And this is what goes on and now we add climate change. We're just going to throw a little gasoline now on that urbanization fire. In this session, this is Jeff Scott again, we're going to cover a slightly different part of climate change, just some of the underlying physics involved and what really drives climate change. And as you can see, most of climate change, you've all probably seen some slide like this. We know that the combustion of fossil fuels, the accelerated combustion of fossil fuels, has added more CO2 to the environment. And CO2 acts as a heat absorber to essentially heat the atmosphere up. And this in turn has caused dramatic changes in long-term projected temperature changes. As you can see in this next slide, we see very clear evidence, and these are data from Dr. Tom Peterson, a member of the IPCC, the Intergovernmental Panel on Climate Change, with the latest projected change in temperatures through the end of the next century. And while there's a lot of data, we already know that temperatures, if we start on the far right, you can already see that temperatures have increased a couple of degrees Fahrenheit already. And what we see as we look at these models, the most extreme changes don't occur here in the mid-latitudes or near the equator, but they occur in the poles. And that's because the temperature is basically our oceanic currents move that heat to the top or south pole and redistribute that heat. This in turn can cause the melting of ice, and it can also cause the release of what's in that ice. And many of the things in that ice will be things like chemical pollutants. In fact, all of the airborne pollution from the Industrial Revolution, as it was transported to the Arctic, was captured in the ice, a lot of it, to prevent the active cycling of much of that pollution through Arctic ecosystems. In a matter of 40 or 50 years, we're going to release and unchain all that pollution and release it into global ecosystems. What effect is that going to have? Well, what we see is, in this slide, is some data where we're looking at the effect of low levels of certain chemicals that are found in the ice, such as a couple of pesticides, endosulfan and chlorpyrifos, the effect of that low level exposure on freshwater fish. It causes the fish to have much lower thermal tolerances. So at the very time we're turning up the thermostat on the planet, we're turning down the thermostat on key species because of the interactions of these pollutants associated with urbanization that will lower the thermal tolerance. This is what I call a recipe for disaster, because what this means is we're going to have catastrophic losses of species in certain areas. We also see evidence in other species, for example, plants. We can already see, if we look at the plant hardiness zones in this next slide, you can see how more warm invasive plants are moving up into the Midwest and up to the Canadian border. Again, a sign of a time of more thermal tolerance. This last slide really captures what I think is really the most important part of climate change. And this is what we call the concept of moving states. If we take a look in this slide, the area around Chicago by the end of the century will have the same climate as we see in Dallas, Texas. The climate in the northeastern U.S. will have the same climate as Raleigh, North Carolina. When you begin to think about those magnitude of temperature changes in the next 40 or 50 years, it is little wonder that we know this is going to affect the distribution of infectious agents. It will cause the distribution of insect vectors of disease. This will cause the occurrence of harmful algal blooms, which can lead to health issues. All of these manifestations of climate change and temperature will have profound impacts on the climate you live in your lifetime. Jeff Scott again, and let's continue our dialogue on climate change. We talked last time about how temperatures are going to increase and how this will affect the global distribution of organisms, particularly things like infectious agents. One example in particular are Vibrio bacteria. Most of us in public health are familiar with Vibrio bacteria and how Sir John Snow was able to understand the occurrence of illness associated with Vibrio cholera and is a very backbone of epidemiology and public health. Well, we have an ongoing riddle on Vibrios today that's related to climate change. And in fact, Vibrios are one of the species. We have seen 1,000-kilometer range extension of one species of Vibrio, Vibrio parahaemolyticus, which used to occur as far north as Seattle and Vancouver. It's now moved all the way up to the Gulf of Alaska. We also see in this next slide the occurrence of these illnesses and how deadly these illnesses are. Besides Vibrio cholera, we have Vibrio vulnificus. You can see the lesions that this causes. The only thing we can do about those lesions is to amputate, and the fatality rate with this type of illness is over 60 or 70%. 85% of all the illnesses from seafood are caused by Vibrio vulnificus. Vibrio parahaemolyticus, first cousin, is also found in sushi, in uncooked fish. So uncooked seafood and in oysters and clams and uncooked fish are major sources. But we know that climate change is causing this illness to spread. We have seen over a 30% increase in the occurrence of the virulence of these organisms in the last 10 years and a 40% increase globally in the number of cases worldwide. In the U.S., you can see in this slide, Vibrios are one of only 3 illnesses that continue to see a dramatic increase in the number of cases. In the last 10 years, we've had over 100% increase in the number of cases, and the nature of the illness has moved from seafood consumption now to wound infections because these Vibrios are so virulent, and so many times antibiotic resistance. And that resistance is also turned on, antibiotic resistance may be turned on also by temperature and sea level rise. We see in this final slide the occurrence of Vibrio cases along the coast of North Carolina. You'll notice they occur right in the middle of the state, not in population centers in Raleigh or Charlotte. So why is everybody getting sick right along the coast? That's because these are not from food consumption, they're wound infections, and it's associated with sea level rise. This area of North Carolina has the highest rate of sea level rise in the lower 48 states in the United States. Just to make this point to you, in the last 3 years, we have seen major occurrences of Vibrio illness in the United States. For example, we have had an outbreak of Vibrio parahaemolyticus in 2013 down the entire east coast of the U.S. that was brought in a container ship from Seattle. Again, that originally was brought into Seattle from the Middle East, from Pakistan. And then finally, if we go to the country of Haiti, we all know about the earthquake there. The Neapolitan peacekeepers that were brought in by the UN brought in an imported strain of Vibrio cholera to Haiti, never seen in this hemisphere, and we now have had over 9,000 deaths in Haiti. We talk about all the Ebola deaths. Nobody talks about all the people in Haiti that have died, the 9,000 people that have died. 6% of the population in Haiti has had cholera in the last couple of years. So if you do not believe Vibrios are a big deal, they are. They are a big deal abroad, and they're a big deal right here in our own nation. Jeff Scott, continuing our discussion on climate change here and public health. We've already mentioned that the Vibrios are a very significant issue, and we've mentioned the effects of temperature. But let's talk a little bit more now about sea level rise. Particularly, this is a huge issue along our coastal areas where we have all the urbanization, because the frequency of storms, tropical storms will be more frequent, and also the rate of sea level rise instead of only being 6 to 8 inches, it's going to be more like 30 or 40 inches in the next 100 years. And you can see this projection of the increase in sea level rise and what it can cause in the next 100 years. Again, let's talk a little closer to home. If we take a look at this next slide, you'll see in that first picture one of Charleston, South Carolina's finest, a police car that's underwater. And this is because we have had an afternoon thunderstorm in a highly urbanized area at the time of a flood tide, simulating what would be the effect of climate change. And look what happens. There is nowhere for the water to go. And look what happens even to the police. They cannot escape the effects of rising sea level. There is nowhere for that police car to go but underwater. So you can see right away this has tremendous effects on coastal infrastructure, things like our drinking water supplies, our sewage treatment plants, all of those, our roads, all of the things that we take for granted. We have to be extremely concerned and building landward of where sea level rise will occur. Otherwise, we will have to be replacing those infrastructures, which will cost lots and lots of money. So the thing about sea level rise that's most significant is this dramatic increase that we see with the melting of the water, the ice in the globe, in our Arctic areas, which will cause the sea level to rise. This in turn will cause more flooding and will lead to catastrophic conditions along our coastal areas. Finally, one last area, again, this is Jeff Scott again, that we want to cover today is the occurrence of emerging contaminants associated with urban development and the increased exposure that we have due to the change in the hydrological cycle to many of these chemicals. One class of chemicals that particularly is noteworthy that you should remember and be aware of are antibiotics. This first slide shows the occurrence of antibiotics in national monitoring programs. 48% of all sites have antibiotics present in waterways. Now, the reason I point out on antibiotics, unlike other chemicals, with most chemicals, the higher the dose, the greater the effect. But as you can see in this slide, the lower the dose, the quicker we are to see the development of antibiotic resistance. That's why your doctor always says, make sure you take the entire prescription so that you kill the bacteria, not create antibiotic resistance in the bacteria, which can then lead to more problems in terms of the manifestation of an infection. We see in this next slide, if we look at surface waters around the United States, in some parts of the country, such as Florida, as much as 1/4 of the bacteria you'll encounter when swimming in the water or drinking the water, if it's untreated, are antibiotic resistant strains. That's a pretty large number. And in fact, that number can be much higher than the amount of antibiotic resistant bacteria we actually see in places like sewage treatment plants, where it's only about 8 to 12%. Because one of the things we do in the marine environment, because of the nitrogen and phosphorus, other things that we have in the water, those are fertilizers to grow microbes. And so we end up with much higher rates of antibiotics oftentimes in the environment than we do in places like sewage treatment plants. Here we see our dolphins, for example. We see over in Charleston Harbor, we see as many as 39% of our dolphins have antibiotic resistant bacteria in their blowholes and rectal swabs that we analyze. They're not given those antibiotics. This isn't SeaWorld. This is living in nature, and nature now includes low-level exposures to antibiotics. This occurrence of antibiotic resistance is a huge issue. We know that antibiotics can be, the genes that cause antibiotic resistance can be transferred among different bacterial species. Again, if we go back and look at our Vibrio bacteria, which we've been talking about earlier, if you take a look at the number, this is a slide of the occurrence of Vibrios in Charleston Harbor and along the southeast coast. Less than 1% of the Vibrio bacteria have no antibiotic resistance. Translated, that means 99% of the Vibrio bacteria are highly antibiotic resistant, and over 70% have resistance to 10 or more antibiotics. That means if you get a Vibrio infection, you better hope the doctor picks the right antibiotic. And that's why we've changed the treatment protocols on Vibrios now to include a panel so we don't guess, we pick the right antibiotics, because we know we were killing people by giving the wrong antibiotics and feeding infections. Finally, this last slide really shows the magnitude and impact of this in terms of the U.S. Every year we spend $950 million in healthcare related costs for illnesses related to swimming in the environment or eating seafood. That's nearly $1 billion. 30 million of that is Vibrio alone. So I go back to my earlier slide on those Vibrios. If we have 10 times the number of Vibrios, that number goes from 30 million to 300 million. I'll end with one last final statistic. The Prime Minister of Great Britain and the European Union has thought this issue of Vibrio, of antibiotic resistance, is so significant, they have commissioned a study. And right now, worldwide infections from antibiotic resistance cause less than 1 million deaths. By 2050, they will cause over 10 million deaths, which is more deaths than we have annually from cancer globally. The estimated cost on the global GDP, gross domestic product, will be around 6 to 8% because of the cost of antibiotic resistant infections. To put that into proper understanding, that's the same projected impact just from antibiotic resistant infections that we think the effect of global climate change by 2050 will have on the world's economy. The two are interrelated. So we have to pay attention to these issues of climate change and public health. They're inextricably related, and you'll have to be a professional that understands this to deal with this in your lifetime and in your future. Well, I thank you for that, and good evening.